So I wanted to run through some general anatomy of the spine and some of the terminology that we use related to the spine. These are the bones of the lumbar spine, and in between each bone is a shock-absorbing disc. And these discs allow for some shock absorption and also allow for some motion between the bones. These are the vertebrae. These are the intervertebral discs. Here in the back of the spine, this is the front of the spine, and here's the back of the spine. In the back of the spine, we have the facet joints, okay? And these are between each of the vertebrae. And the facet joints also provide some motion. This in here is the spinal canal. This is where the spinal cord would be. It runs through the spinal canal. And then there are nerve roots which run out of each spinal segment. And each of these nerve roots is numbered. And these nerve roots come together and form the nerves that radiate down our legs, and in the neck radiate down our arms. So these nerve roots come together to form the sciatic nerve, and when those nerves are irritated, it causes what's commonly known as sciatica. So here's where the nerve roots come out. When we have a disc herniation, the disc comes out and pinches the nerve as it comes out of the spine. We're talking about the lamina here. This is the spinal lamina. We've removed a portion of the spinous process here. These are the spinous processes. This is the back of the spine, and these are the bones that we feel when we push on the center of the back of our spine. Here a piece of the spinous process is removed, and this would be a portion of what we call a laminectomy. The lamina is the portion of the spine which is the back of the spinal canal. The spinal cord or nerve roots run inside the spinal canal. And when people have pinched nerves inside their spinal canal, then sometimes we could remove the lamina, and we call that a laminectomy. A laminotomy would be just to remove a small portion of the lamina, but a laminectomy would be to remove the entire lamina, and by removing this piece of bone, it takes the pressure off of the nerves, which are causing pain radiating down the legs. This bone is not necessary. It's where some muscles attach, but we're able to reattach the muscles after this bone is removed. And this can significantly improve someone's radiating leg pain or spinal stenosis.